every other country guarantees health care to all people as a right. Should we?
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
So Bernie Sanders was at the Senate Health and Human Services Committee, where he had a heated argument with RFK Jr. on the topic of healthcare. You can see that he asked a simple question of why America doesn't offer free healthcare services despite being the richest nation, when majority of other countries do. But RFK Jr. responded that this is a very philosophical question and he can't answer it yes or no. This is a common tactic used by a lot of politicians, especially conservative right-wing pundits. They will deviate from the main argument and make some other points to make it look like they answered the question. Even though they didn't, like you just saw, it was a bunch of word salad.
Let me stop going back to prescription drugs. Mr. Secretary, did I hear you correctly to state that your goal is to have Americans pay the lowest prices in the world or equivalent to what is paid in other major countries? That is my goal, that you are prepared to work with us on legislation to achieve that goal.
Absolutely.
All right, and I believe there's bipartisan support for it. I believe that if the leadership here prioritizes that, we can do that in a very short period of time. Look forward to that. Let me ask you this, as Secretary of HHS. We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America?
Yes, the million-dollar question. But of course you know it won't be answered yes or no, rather just a bunch of word salads. By the way, this is not the first time it is being asked. They had this conservation before too in the Senate, and I will play the response to that first.
Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that.
All right, so you saw his response there. It wasn't clearly yes or no, so let's see his response here.
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to.
So you saw how similar this response was to that before. He gave that smoking cigarettes for 20 years example again. And again, I still don't understand what's so philosophical about this question. That he is saying is,
I don't have a lot of time, so but I am here.
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's a problem.
So, it's not like freedom of speech, which costs, everybody.
But every other country, Mr. Secretary, every other country guarantees health care to all people as a right. Should we, as Americans?
The objective is to get Americans the level of health care that they want, the choice, which Americans want. Americans
they don't want the choice to be uninsured.
Well, but
they don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe? Okay.
And what I would say is, You know, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the,
Okay, sorry to interrupt you. All right. The reconciliation.
my job is to try to make it work.
All right, I have limited time. All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with the proposals from the president. The president
No, I'm talking
is not
about the
making
congressional bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how
through the
many
estate
people,
tax.
how many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny
Congressional bill.
the top 0.2% will get $235 billion in tax breaks while we cut Medicaid.